In many of my videos, I've described so many different mental health conditions. There's this concept now that I want to describe, which is called severity. Severity is a major consideration when you think about these different mental health disorders, because severity is describing the number of symptoms that someone is experiencing or the impact that a specific condition is having on their life. There's also a concept called severe mental illness. To be clear, this isn't a specific diagnostic term. And in fact, the definition of this term, severe mental illness, kind of fluctuates, with some clinicians or researchers defining it as a condition that has a severe impact on someone's life, whereas other clinicians and researchers describe specific conditions such as schizophrenia and other psychotic disorders as meeting the criteria for a severe mental illness. Now, for me to get back on track real quick, so with severity, there's differences in severity related to these specific conditions. The impacts of these symptoms and how that condition can impact that person's life can vary between people, with one example being alcohol use disorder. Alcohol use disorder can range in severity from mild to moderate to severe. Mild is when someone is experiencing 2 of 3 of the symptoms related to an alcohol use disorder diagnosis. And if you want to know more about alcohol use disorder, feel free to check out my profile. There's another video describing alcohol use disorder. But mild severity is when someone has 2 to 3 symptoms of an alcohol use disorder. Moderate is when they have 4 to 5 symptoms of an alcohol use disorder. And severe is when they have 6 or more symptoms related to an alcohol use disorder. The key takeaway from this video is that while these mental health disorders do exist, they range in severity, and that presentation of that range in severity can definitely fluctuate between different individuals. And sometimes within that person, they may have a mild or moderate or severe condition at different stages in their lives. With that introduction to severity, next I will discuss this concept of differential diagnosis. Thank you so much for watching, and I hope you will watch the next one. Thank you.